Thank you for viewing MedicalGPS's Service Improvement Program. This video covers step number 7, messaging what, when, and why. As we explore messaging, what, when, and why, we're specifically looking at ways for you and your team to improve same-day callback turnaround times. To that end, we'll explore why messages occur, setting patient expectations, how to reduce message volumes, the importance of telephone intake, and then lastly, same-day callback best practices. There are a couple of major reasons why messages occur. First, the obvious. Workload exceeds the available resources during a given time period. For example, in primary care, think of Monday mornings. The bolus of patients calling the office around 9 to 10 o'clock usually will exceed the number of staff members available to handle those calls during that peak period. The second reason may be less obvious, but still just as useful to know and to find solutions for, and that is the support staff that are handling the messages may need additional training, perhaps a different skill set, providers' permission to take action, the administrator's permission to take action, and encouragement to act after new procedures and processes have put in place. Setting patient expectations begins with collaborating with your providers. Allow every provider to provide feedback and input regarding the establishment of callback guidelines and standards. Likewise, there are key support staff members that should have input as well. Those key support staff members are often called on to execute these standards and protocols. Allow the support staff as well as your providers to provide input and then reach consensus on callback guidelines and standards that will work for your patients. Once you have those standards established, put them in writing and train your staff accordingly. As part of those standards, you'll have a same-day callback cutoff time, meaning as patients call in the afternoon, there'll be a cutoff time whereby those patients are advised they'll receive a callback not later than a certain time the next morning. In this particular example, the cutoff time was 4 p.m. and the callback time was 10 a.m. That window, that commitment window, may work or it may not work for your practice. So adjust the 4 p.m. cutoff as needed, make it earlier or later if possible, and adjust the callback time commitment of 10 a.m. to make it later or earlier if possible. The important thing is to establish a callback commitment window that can be consistently achieved by your team. Once you have that window established, communicate it, advertise it to your patients often. Setting the patient's expectations is the key. In addition, if you don't already, as each of those messages come into your practice, assign that message to a staff member for follow-up. Lastly, track and then communicate the message return compliance, compliance to the standards, compliance to the protocols. Establish that compliance feedback loop such that your team, including your providers, are receiving a compliance report not less than once a week. We talked earlier about why messages occur in the first place. One of the obvious reasons we talked about was the number of patients needing assistance at any given time during the day exceeds the number of support staff available to assist those patients. Reducing the number of messages helps eliminate that situation entirely. For example, try the following to help reduce the number of patients calling back after their visit. Ensure all questions are answered at the time and place of service before the patient leaves the office. Have staff members ask the following: what additional questions do you have? Explore those questions with the patient, answering thoroughly and having the patient confirm back to the team member that they understand and comprehend the answer. What did the doctor tell you about next steps? Again, having the patient explain in their own words what their plan is, and then having that plan reiterated a couple of times before they leave will help the patient comprehend their plan and not have to call the practice back later to get information about their plan. And then lastly, when did the doctor say your lab results would be ready? Explaining when lab results are typically ready and politely discouraging patients from calling about their results prior to when the results are expected is a huge opportunity to reduce message volumes. So ask patients, when did the doctor say your labs might be ready? And then one very effective technique is actually to have the patient mark in their calendars when their lab results will be ready. So if the lab results typically take 10 days from the date of visit, simply work with the patient, have them pull out their calendars and mark their calendars 10 days into the future for when their lab results will be ready. It's a simple technique, but very effective in helping that patient understand when their labs are going to be ready and hopefully not calling the office during the interim asking about their labs. If the patient does happen to call back during the interim before their labs are ready, this script can be used or something very similar to let the patient know that their labs are not currently ready, and then if they didn't mark their calendars, to go ahead and mark their calendars for when the labs will be ready. Let's talk a little bit more about reducing message volumes. After you've gone through this slide presentation, and perhaps you've conducted an audit of messages that are coming in and through the practice, it might be a great time to go back and revisit refill protocols and scheduling guidelines with your providers. So after you've taken some steps to understand what types of messages are coming in and through your practice and what might be done to help eliminate some of those messages, revisit with your providers some refill protocols and scheduling guidelines. Most practices today have patients call their pharmacy for prescription refills. If that's the case for your practice, but you still have patients calling the practice for a refill, it could be time to step up efforts to educate patients about calling their pharmacy whenever they need a refill. Some of the ways to do that would be posting flyers around the practice, perhaps in the exam rooms, that patients should call their pharmacy whenever they need a refill. If you have a telephone auto attendant, perhaps embed in the greeting that patients should call their pharmacy whenever they need a refill. And then lastly, simply ask your team members to remind patients to call their pharmacy whenever they need a refill. Regarding scheduling guidelines, this is one of the areas that might help reduce the number of messages the most. For example, when you do a message audit and you review the types of messages that your team's members are taking, if you see a lot of messages relating to obtaining permission to book appointments, that's your red flag, as it were, that there's an opportunity here perhaps to revisit the scheduling guidelines. For example, if your frontline team takes a message to obtain permission to work patients in or book same-day appointments, and you see that repeatedly when you do your message audit, that's an opportunity to go back to your providers, better understand what is the thought process to work patients in for their practice, and then build some guidelines and instructions so that your support staff can be empowered to book those appointments at the first point of opportunity and not have to take a message at all. So empower support staff to book appointments, book same-day appointments without needing additional permission, all the while doing that with the physician's instructions and guidelines in place. After the visit, book patients' follow-up appointments at checkout or at some point during the visit. This will help the patient not have to call the office and book that appointment into the future. And then lastly, when you do your message audit, evaluate the compliance to those protocols that you now have in place. You've got updated prescription refill protocols, for example, and you've probably got some streamlined scheduling protocols that's designed to empower your frontline staff to book appointments. So as you do your message audit, week in and week out, you should see a fewer number of messages related to appointments and hopefully prescription refills, which tells you and your team are on the right track. If that's not the case, go back and revisit those messages that have to do with appointments and prescription refills and see if there's a need to update those timelines or retrain your support staff as needed. As we bring this video about messaging to a close, we'd like to talk about the importance of telephone intake and how it impacts messaging. A telephone call is usually still the first point of access for patients, and the service provided via the telephone often makes a lasting impression. We studied more than 16,000 patient responses, and we found that after the patient-provider encounter, how the telephone was handled had the highest correlation to overall patient loyalty. Collaborating with providers to develop scheduling guidelines and RX refill protocols is indeed the foundation for empowering your team to handle the patient's request at the first point of opportunity. Handling the patient's request whenever they call without having to take a message increases the likelihood that the patient will perceive the practice as providing great service and great care. There are many subsystems connected to the telephones. Think about the process that happens whenever a message is taken or if the patient's phone call is handled at the first point of opportunity. In both of those instances, what happens via the telephone makes a huge difference for your patients. In summary, here are the 5 best practices related to messaging and same-day callbacks. Providers and key support staff collaborate to develop and update written guidelines regarding same-day callback standards. Written provider protocols are in place and updated as needed as related to RX refills and appointment scheduling. Patients are educated regarding when to expect a return message. Process messages are reviewed at least weekly to ensure guidelines and protocols are followed and standards are met. A message compliance report is utilized and communicated to providers and staff weekly. If you have questions or comments, we'd love for you to drop those in the comments section below. Let us know if you need anything. We'd love to help you and your team. Thank you.